Bismillahirrahmanirrahim. Dear student, Assalamu alaikum. Today I want to discuss about blood pressure and how to measure the blood pressure. What is blood pressure? Definition of blood pressure. Blood pressure, pressure exerted on the wall of the wall against any unit area of the blood vessels, or blood pressure is the lateral pressure exerted on the wall of the vessels by the contained blood while blood flowing through it. Now you see, blood pressure is the product of cardiac output times the total peripheral resistance. Before I have given a lecture about the flow is directly proportional to delta P and inversely proportional to resistance. If you convert this, delta P is the pressure and flow is the cardiac output and times the resistance. Now what are the types of blood pressure? This is the systolic blood pressure, diastolic blood pressure, pulse pressure, mean arterial pressure. What is systolic blood pressure? It is the maximum pressure during cardiac systole. It varies from 100 to 140 millimeter of mercury. What is diastolic pressure? Diastolic pressure is the minimum pressure during ventricular diastole or cardiac diastole. It varies from 60 to 90 millimeter of mercury. Now come to the pulse pressure. Normal varies of pulse pressure 30 to 40 millimeter of mercury. What is pulse pressure? It is the difference between systolic pressure minus diastolic pressure. Now, mean arterial pressure. Normal values is 90 to 100 millimeter of mercury. What is mean arterial pressure? It is the average pressure throughout the cardiac cycle. What does it mean? It is the average pressure throughout the cardiac cycle. A cardiac cycle having systole and diastole. Now, how you calculate the mean arterial pressure? Definition, it is the average pressure throughout the cardiac cycle. But how you can calculate the mean arterial pressure is the diastolic pressure. It is the diastolic pressure, blood pressure, plus 1/3 of pulse pressure. This is diastolic. Diastolic blood pressure plus 1/3 of pulse pressure. Now, sometime you will get in OSPI. They will give you systolic pressure 130 and diastolic pressure 70 millimeter mercury. Find out the mean arterial pressure. That is, you see, first the systolic pressure, how much? It is 130 millimeter of mercury and diastolic pressure is 70 millimeter mercury. How much the difference? The pulse pressure, you are find for the 60 millimeter of mercury. 1/3 of 60 millimeter mercury is 20 millimeter of mercury. Now, mean arterial, how you can calculate the mean arterial pressure? Diastolic blood pressure plus 1/3 of pulse pressure. That is, diastolic blood pressure is 70 and 1/3 of pulse pressure is 20. This is 90 millimeter of mercury. Now question might arise, why you have choose the diastolic pressure? Diastolic pressure more or less it is constant. More or less it is constant, but systolic pressure varies for period to period. Now, how you can measure the blood pressure? For measurement of blood pressure, what instrument needed? What are the instruments needed? The instrument is sphygmomanometer, another is stethoscope. This sphygmomanometer is aneroid. Aneroid means the ear pressure. Now, during measurement of blood pressure, there are two ways. One is palpatory method, another is auscultatory method. By palpatory method, you can measure only systolic blood pressure. But auscultatory method, you have to record both systolic blood pressure and diastolic blood pressure. Suppose if you got a blood pressure 120 and 70, 120 is a systolic pressure and 70 is the diastolic, how would you write this? Systolic over diastolic pressure. You have to write in your paper, this is 120 by 70. It does means that systole is 120 and diastole is 70 millimeter mercury. This is the way of technique to write to blood pressure in your prescription paper and other. Now I'll show you some instrument required for the measurement of blood pressure. This is the sphygmomanometer. It is the aneroid, sphygmomanometer aneroid. This is cup. This is cup. Cup having several sizes, some adults, some children, some infant. This is the meter. This is the meter. And this is the bulb. Another things, you see, this is the stethoscope. Stethoscope having several parts. This is the diaphragm. This is the bell, B-E-L-L, bell. This is the earpiece. This is the connectivity. Sometimes ask, what is the use of this stethoscope? Stethoscope is used for several, to determine the heart rate, to determine the intestinal sound, and to determine the other sound, root and renal root. And bell is sometimes used to record the fetal heart sound, and sometimes the mitral valvular disease, the mitral murmur. Now, how would you measure the blood pressure? First, you see, this is the sphygmomanometer. This is the cup. This cup you have to wrap in the upper mid-arm here, just above the cubital fossa, about 2 inches above the cubital fossa. By this cup, if you inflate this cup, air goes inside and it will occlude the brachial artery. And why you have to choose the brachial artery? Brachial artery is at the level of heart, and also it is easy to locate, and it is easy for male and female. Now, by this, first you have to wrap this. You have to wrap this on the arm, mid-arm, just above 2 inches above the cubital fossa. Then you have to inflate by this bulb to occlude the brachial artery. Then after some time, if you release this air from this cup, that you will get a sound. That sound is called Korotko. Its name, who discovered this? This is Nikolai Korotko in 1905, Russian physician. First, when just open the brachial artery, there is a sound. First sound is called tapping sound. This tapping sound represents the systolic blood pressure. Then quality of the sound changes from murmur, tapping sound, then it goes to the murmur, then it goes again louder, then it will muffle, and then it is a dizzy appearance. The tapping sound indicates the systolic pressure, and dizzy appearance indicate the diastolic pressure. Why this Korotkoff sound occurs? It is the jetting of blood through the occluded brachial artery and some vibration of the vessels. Why this is the sound? When the blood flows through the occluded vessels of brachial artery, it is jetting. It is make a sound just like jet engine, and also the vibration of the blood vessels. Now, some clinical importance. Now, what is hypertension? Hypertension is the persistent or sustained rise of blood pressure above the normal range, irrespective age and sex. It is not the temporary rise of blood pressure. It is the sustained. Several times, if you take the blood pressure, if it goes above the normal range, then you have to tell it is the hypertension. It is the hypertension. Now, what are the types of hypertension? One is essential hypertension, another is secondary hypertension. 95% of patients suffer from essential hypertension and 5% are secondary hypertension. What are the cause of secondary hypertension? One cause is kidney cause, chronic renal failure. Another is endocrine gland. Which endocrine gland responsible for hypertension? Adrenal cortex, adrenal medulla, and toxemia of pregnancy. Toxemia of pregnancy, also called the hypertension. Now, normally, what are the primary hypertension? Primary blood pressure. One is systolic and diastolic blood pressure. These are the product of systolic and diastolic pressure. Which pressure is more important? This is the diastolic blood pressure. With diastolic pressure is more or less constant, and the heart has to work against the diastolic pressure. Therefore, if diastolic pressure is increased, you have to treat to reduce the diastolic pressure quickly. Effects of exercise on blood pressure. What are the effects of exercise on blood pressure? There are three types of exercise. One is mild, moderate, and severe. In all three types of blood pressure, exercise, the blood pressure, systolic blood pressure will increase. Systolic blood pressure will increase. All three types of blood exercise, systolic blood pressure will increase. But in mild exercise, diastolic blood pressure will remain normal. In moderate and severe exercise, systolic blood pressure increase, but diastolic blood pressure fall. Now, effects of gravity on blood pressure. Effects of gravity on blood pressure. You know, at the heart level, that is, this is the heart level. How much the heart level mean arterial pressure? It is about 100 millimeter of mercury. If pressure below the heart is increased, above the heart is decreased. This is due to the gravitational effect. From heart to arterial doctoralis pedis, it is about 100 centimeters. From here, the distance is 100 centimeters. Every centimeter down, the blood pressure rises about 0.77 millimeter. Every centimeter above, the blood pressure fall about 0.77 millimeter. Now, it is anything below the heart, the blood pressure will increase. Above the heart, the blood pressure will increase. This is the effect of gravity. And three types of exercise. In all exercise, the systolic blood pressure is increased. What are the types of exercise? One is mild, moderate, and severe. In mild, moderate, severe, the systolic pressure is increased. In mild exercise, diastolic pressure remains 4. But in moderate and severe exercise, diastolic pressure is 4. Thank you, student. Assalamu alaikum.